Hello. On behalf of the Mountain Plains Regional Disaster Health Response System, I'd like to welcome you to this, the seventh of our nine-part series of the Be Nice Weapons of Mass Destruction course. My name is Peter Pons. I'm an emergency physician in Denver, Colorado. In this particular module, we're going to talk about radiologic and nuclear weapons of mass destruction. The objectives are that we're going to describe the principles to recognize the potential for exposure, the treatment and management of radiation casualties, and how to protect oneself while doing so. Now, radiologic incidents, unfortunately, are not unheard of. In the 55-year period ending 1999, there were almost 250 incidents in which significant exposure occurred. Over 1,300 people were exposed and 30 ended up dying. If you look at the location in which these incidents occurred, notably, medical and diagnostic facilities accounted for the overwhelming majority of these. And fortunately, the most common location of the body that was injured were just fingers and hands. But as you look down this list, you can see that there were a number of fatalities. From 2000 to 2013, again, you can see every year we average about 4 or 5 incidents involving radiation. And while most were unintentional, you noticed a few were intentional. And again, looking down the casualty column, there's a significant number of casualties and a number of deaths related to this. Now, in terms of radiologic and nuclear devices and their potential use in terrorism, there are a number of ways this may occur. A simple radiologic device, a radiologic dispersal device, a reactor incident, and then obviously nuclear weapons, whether they are improvised or formal. Simple radiologic device. This is where someone is able to obtain a hunk of radioactive material and place it in a location in which someone nearby would be exposed. From a terrorism perspective, obviously not very effective in terms of involving large numbers of casualties, and it would take a while for symptoms to develop. So, if you want to get attention, this may not necessarily be the best way to do it. But having said that, these incidents have happened, although not necessarily terrorist related. The most notable, perhaps, was 1987 in Brazil. A cesium source was left in an abandoned clinic. It was found. The shielding to it was opened up, and the people that found it later sold it to a junkyard. The owner of the junkyard thought, wow, this stuff is really pretty cool. It glows in the dark. It's got this blue color. It would make a really nice cosmetic. So he distributed it to friends and relatives. As a result, over 110,000 people ended up being surveyed for contamination. Almost 250 were found to have been contaminated. 20 required hospitalization, and 4 ended up dying as a result. Other incidents, well, in the US, we've had radiologic sources stolen, one in North Carolina, one in Florida, never recovered. What happened to it is unknown. Now, radiologic dispersal device. This is where you take that same amount of simple radiologic material, and this time you attach it to an explosive. Then when the explosive is detonated, that radiologic material is dispersed over a much larger area. This would not cause a nuclear explosion. This is a simple explosion in which the radioactive material is dispersed. Now, the good news perhaps about this is that from a radiation perspective, The health risks are actually really pretty small. The radiation gets dispersed over a large area, so the likelihood of anyone becoming very ill from this is actually quite low. On the other hand, the psychological impact of knowing that radioactive material is now located in a particular area, that would be significant. In terms of these devices, there are only two known incidents in which this has actually happened. Both occurred in Chechnya, and in both cases, the devices were found prior to detonation. Now, having said that, there have been a number of cases in which the materials to potentially build a radiologic dispersal device have been found, but the device itself was never actually prepared. Nuclear reactors might seem like an attractive target for a terrorist, but the reality is they are relatively well protected. The reactors themselves have lots of thick shielding, so the ability to breach a reactor would be actually rather difficult. But we have had a number of accidents, if you will, related to nuclear reactors. Here in the US, perhaps the best known is the 3 Mile Island incident in Pennsylvania. Chernobyl, of course, in the Ukraine, and then most recently, the Fukushima incident after the earthquake in Japan. The bottom left picture is actually 3 Mile Island. The bottom right picture is Fukushima. The incident in Chernobyl was one that actually could have been avoided. The operators were conducting an experiment. They violated their routine safety standards. They ended up with a steam and hydrogen explosion that destroyed the roof of the reactor. There was a huge fire. The containment was breached and radiation was spread over a large area. The photograph shows the melted remnants of the radioactive material in Chernobyl. This is referred to as the elephant's foot. This thing is so radioactive that exposure of less than 5 minutes is enough to prove fatal. In this accident, 2 were killed initially by the explosion. 237 were subsequently hospitalized. About half developed acute radiation syndrome as a result of cesium and iodine exposure, and 28 died within 3 months for a case fatality rate of 21%. Now, could a terrorist potentially improvise a nuclear device? Well, it's possible, but not likely again. It takes a fair amount of expertise in order to develop one of these. And while it would be possible perhaps to create a partial yield, um, it would not be the same as a formal nuclear weapon. Having said that, obviously, the potential for both illness, injury, and psychological effect would be significant were this possible and were this to happen. Now, if someone was able to get their hands on a formal nuclear weapon, obviously that would be a devastating attack. The size of the weapon would determine the extent of the damage. Um, Detonating a nuclear weapon causes a serious blast wave, a thermal pulse, and fires. We would see not only radiation sickness, but multiple trauma, burns, etc., that would overwhelm the healthcare system. Now, radiation. As you may recall fondly from high school physics, ionizing radiation is energized electromagnetic energy or energized particles that are emitted from a source. When this energy encounters the atoms in a molecule, it strips electrons from them and causes damage. In the human, this happens literally in microseconds. It damages proteins, it damages cell membranes, and it damages DNA. And then over time, And the length of that time varies depending on the amount of radiation to which someone is exposed. That damage becomes manifest. It can happen in hours, it may take years. You may also remember the types of radiation: alpha radiation, heavy particle, relatively slow moving, ionizing, two neutrons, two protons, um, relatively easy to protect oneself from it. It's stopped by paper. The major threat from alpha particles is inhalation or absorption and then incorporation into tissue. Beta particles, high energy electrons, these are moderately penetrating. They also pose an inhalation and absorption risk. Gamma energy, these are high energy rays, very penetrating, tough to shield from, takes several feet of water or concrete to protect oneself from this. And neutrons, also very penetrating and require special shielding. Now, the reality is there's radioactive materials out there being used routinely. If you have smoke detectors in your home, there's a tiny radiation source in there. Obviously, we use radiation for medical therapies, for thermoelectric purposes. Reactors are not uncommon and obviously have a large source of radiation. There's nuclear weapons, um, and radiography. We use x-rays all the time in the hospital. How do we measure the exposure to radiation? Well, there's actually four terms you should be aware of: the rad, the rem, the gray, and the sievert. The rad is the radiation absorbed dose, and this is the basic unit for measuring radiation. The term rad has now largely been supplanted by the use of the term gray. The gray equals 100 rad. The rem, or the Röntgen equivalent in man, this quantifies the amount of damage from a particular radiation dose. This term has now largely been supplanted by the sievert, and a sievert equals 100 rem. For all intents and purposes, the rad is the equivalent amount of radiation to the rem, and the gray is the same as a sievert, with very rare exceptions. Now, every year, people get exposed to radiation unintentionally. Um, Background radiation, on average, is about 360 millirems. And for those of us that live in Colorado, because of our altitude and the fact that we have less atmosphere to shield us, we probably get a slightly more amount. A chest x-ray is 10 millirems. A flight from Los Angeles to Paris, 5. Barium enema, more. If you're a smoker, you get 16 rem. If you do a heart catheterization, you're getting about 45 rem. And in order to have a dose large enough to develop mild radiation sickness, you're talking about 200 rem or 2 gray. And the dose that will prove fatal to 50% of the people who receive it is 450 rem or 4.5 gray. Now, to give you some idea of the LD50, that lethal dose for 50% for various species, you can see, looking at this list, that humans are relatively susceptible to radiation. Whereas, if you're worried about this and believe in reincarnation, come back as a snail. Now, protecting yourself from radiation obviously involves a number of factors: the duration of time to which you're exposed to it, how close you are to the radiation source, and the use of any available shielding. All three of these things determine the amount of radiation that one is exposed to. And you can be exposed in a number of ways. There's external irradiation. There's contamination, both external or internal. There's incorporation of radioactive materials, and then some combination of those three. This is irradiation. This is similar to getting an X-ray in a hospital. There's a excuse me. There's a radioactive source. You see it on the left, and then either part of or the entire body are irradiated by that. The radiation passes through the part, but the individual, once they are irradiated, they are not radioactive. They pose no threat to healthcare providers. Again, it's similar to getting an X-ray in a hospital. You get an X-ray in the hospital, you're not radioactive. You don't pose a threat to the healthcare providers who are caring for you subsequently. External contamination, shown on the left, means that radioactive material has been deposited externally on the skin. Internal contamination means that that radioactive material has either been inhaled, swallowed, absorbed through the skin, or introduced into wounds. And obviously this poses a significant risk because it's much harder to remove. In the bottom middle photo, what you see is an alpha particle that has been embedded in lung tissue. Incorporation of radioactive material happens after internal contamination, and that radioactive material is then taken up by various organs, most commonly the thyroid, the lung, the liver, and bone. And as you might guess, over time, the likely outcome is the development of cancer. Now, we can also talk about the likelihood of survival based upon the radiation dose. If the radiation dose was relatively low, less than 1 gray or less than 100 rads, then survival is likely. If, on the other hand, the dose was large, 8 gray, 800 rads, survival is unlikely. And then in between, depending on management and the total dose, survival is possible. Now, the acute radiation syndrome is the clinical group of symptoms that occur after the body has been totally irradiated. Typically, this requires a minimum of 1 gray or 100 rads. This can occur either from internal or external exposure, and important factors that affect the radiation syndrome is the total dose received, how fast that dose was received, how much of the body was exposed, and how penetrating that radiation was. The higher the dose, the earlier the clinical effects occur, the more severe the effects, and the greater the possibility of delayed effects, assuming the individual survives. If someone receives a massive dose of radiation, 1,000 rad or 10 gray, typically symptoms begin within 30 minutes. A dose of half that, 400 rad or so, 4 gray, symptoms begin within 1 to 2 hours. 200 rad, symptoms begin in 2 to 6 hours, and smaller dose usually takes longer than 6 hours. The classic presentation for radiation syndrome is 4 phases. There's a prodrome phase, latent phase, an illness phase, and then either recovery or death. And with a really high dose exposure, you bypass the first 2 phases, the prodrome and the latent phases, and go directly to the illness phase. The prodrome, this is related to the total dose of radiation and occurs within minutes to hours after the exposure. The typical presentation is fever, nausea, vomiting, and loss of appetite. This typically at lower doses lasts about 2 to 4 days, and at higher doses may be persistent. We then enter the latent period. This lasts for couple days, maybe a couple weeks, depending on the total dose received. And while the patient initially looks good during this period, in fact, some critical things are happening. Um, Bone marrow has been damaged. Critical cell populations like white cells and platelets are decreasing. And until they decrease enough, illness does not become manifest. And then we have the overt illness phase. And this typically involves the four body systems, organ systems that you see listed here: hematopoietic, gastrointestinal, central nervous system, and skin. And then depending on therapy, the dose received, et cetera, either that individual recovers or they end up expiring. Now, the illness phase. The hematologic system generally requires a dose of 200 to 1,000 rads, or 2 to 10 gray. The GI system requires more than 600 rads, typically in the 1,000 range. And the central nervous system typically requires more than 1,000, usually about 5,000 rads or 50 gray, in order to become damaged. Here's what's happening in the hematopoietic system. Okay. If you notice the dotted green line, the vertical axis is cell count, the horizontal axis is time. You'll notice that the bone marrow has been damaged because the lymphocyte count is decreasing over the first 24 to 48 hours. If you measure the lymphocyte count at 48 hours, this gives an indicator of the potential lethality of the dose. If the absolute lymphocyte count at 48 hours remains above 1,200, a lethal dose was unlikely. If it's between 300 and 1,200, that was a significant radiation exposure, but with treatment, that patient may recover. Less than 300, this is a critical exposure, and that patient may or may not recover. You'll notice also that neutrophils are decreasing over time. Platelets, while they take longer, they're decreasing, and red blood cells are decreasing. So the potential for infection as the white blood cells drop increases. The potential for hemorrhage increases as the platelets decrease. And then the potential to develop anemia increases as the red blood cell count decreases. So starting at 48 hours, you're going to measure the absolute lymphocyte count. And then over time, you're going to measure the count of all these other blood cell components. The GI syndrome, with that dose of 6 gray or more, the intestinal lining is damaged. As a result, nausea and vomiting within the first couple hours, diarrhea occurs. And then as the lining of the intestine sloughs, opportunistic infection occurs from bacteria located within the bowel. Sepsis can result. And then as blood counts are dropping, bloody diarrhea can occur. And obviously with sepsis, bloody diarrhea, et cetera, these patients tend not to do very well. The central nervous system syndrome, this is a devastating syndrome. Large doses, as I mentioned previously, damage to the central nervous system damages the microvasculature. It leads to cerebral edema because the vascular system leaks. The cerebral edema causes increased intracranial pressure. We see seizures and death literally within hours. For those of you that are movie fans, all of these various syndromes were demonstrated actually quite nicely in the movie K-19 Widowmaker, in which a Soviet submarine has a nuclear reactor accident and the sailors try to salvage the sub, and they demonstrate the acute radiation syndrome actually quite well in that movie. And then the cutaneous syndrome, damage to the skin. And we see this not only from intentional radiation exposures, but radiotherapy that we use for cancer, this occurs. We see swelling, redness, and blistering of the skin. You can get hair loss, nail changes, ulceration, and necrosis with large doses. And if large areas are involved, particularly the entire body, it's a poor prognosis because it means a large radiation exposure occurred. Evaluation and treatment. Well, don standard precautions before treating the patient because of the concern for external contamination. Um, if it's irradiation only, again, let me mention that there is no risk to healthcare providers. All personnel should be wearing dosimeters so they can measure their potential exposure while managing these patients. Assume that all personal property and personnel are contaminated and decontaminate them as indicated. And decontamination is really pretty simple. All you need is water and lots of water. And radiologic surveys using a Geiger counter should be performed to evaluate for external contamination. Now, if the concern is for incorporation and internal contamination, there are medications that can be used to facilitate the removal or limit the uptake. Some are approved by the FDA, some are considered investigational and can be used in an emergency. There are a number of available reports that I would recommend having stored away so that they can be referred to. The National Council on Radiation Protection has developed these reports to guide us in how to manage these patients. And then a reference that I'm going to talk about a little bit more in just a little bit is the Radiation Emergency Medical Management, or REM program. It's available online or as an app for your smartphone or iPad or that sort of device. And this is a free reference that is extremely valuable. Here is some of the various medications that can be used to enhance removal of incorporated or internally contaminated individuals. The one I want to mention the most is actually the last one on this list, granulocyte colony stimulating factors. All of the others, again, we're not going to ask you to remember these. In the event something happens, look up the latest recommendation. But the granulocyte stimulating factors are used for those patients who have bone marrow damage and have proven actually fairly effective in helping the bone marrow recover, helping the white blood cell count recover after exposure to radiation. So key points. I've mentioned this a couple times. I will repeat it again. Irradiated individuals who are not otherwise contaminated pose no risk to responding personnel. If the event involved both radiation and conventional injuries or other illnesses, the life threat, which is the conventional trauma, is the priority. The radiation is a secondary concern. Earlier signs and symptoms indicate the severity and magnitude of the radiation dose. If you have them available to you, health physicists, radiologic safety officers, and radiation medicine specialists can be extremely valuable in both assessing patients and doing things like the radiation survey. Properly handled contaminated patients actually present fairly minimal risk to responding healthcare personnel. So we need to take that into account when we manage them. The major effect is psychological. Now, a couple resources that I mentioned, one of them already, and that's the REM. It's available from the National Library of Medicine. The website you see there, it provides guidance on diagnosis and treatment. The online desktop reference is the website that you see. And when you access that website, they actually have a downloadable application for both iPhones, iPads, and Android devices that is no cost, and it is actually a very nice reference to have should the need ever arise. In addition, there is a publication called Major Radiologic or Nuclear Incidents, Potential Health and Medical Implications from a couple of years ago. It was developed by the Assistant Secretary for Preparedness and Response and the Technical Resources Assistance Center and Information Exchange, otherwise known as ASPR Tracy. It's available at the website that you see on this slide as well. I would highly recommend both REM and this reference for storing away in the hopefully unlikely event that we would ever need it. Thank you very much for your time. Hope you will take a look at some of our other presentations in this series of Be Nice WMD informational presentations. Thank you.